Hello everyone. Today we will see a case study on tuberculosis. So what is this case study? A 50-year-old male was admitted in a private hospital. His chief complaints were cough, poor appetite, excessive joint pain for a period of 1 week, chest pain for 1 month, and weight loss, as well as evening rise in the temperature and breathlessness. So, after observing all these complaints, the doctor has given um, a physical examination. On physical examination, he was found to be conscious and oriented. On laboratory examination, his hemoglobin total count and lymphocytes RBC levels were found to be decreased. So he had a past medical history of tuberculosis also, and he discontinued the medications. So finally, on laboratory and specific investigations, the patient was diagnosed as uh, pulmonary tuberculosis. So what is the specific test for this tuberculosis? It is a sputum culture and sensitivity test that found to be positive for that person, and chest X-ray also shows that person is having the tuberculosis. So what is the cause for this tuberculosis? Tuberculosis is a bacterial infection which is caused by Mycobacterium tuberculosis. uh, it is spreading from person to person through droplet infections, and that is through a microscopic droplet uh, that will be spread through air. So this can happen when someone with the untreated active form of tuberculosis coughs, speaks, sneezes, spits, laughs, or sings. So that will be communicated. So what are the risk factors for this tuberculosis? Those who are having low body weight, babies and young children whose immune systems have not been matured, and peoples with chronic conditions such as diabetes or kidney disease, and people with HIV or AIDS are susceptible to this tuberculosis. So, what are the drugs to be given for the treatment of this tuberculosis? They will give isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin, and for pain purpose, they will give the paracetamol. So, I am repeating that one. What are the drugs will be? Isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin, and for pain relief and for analgesic and antipyretic action, paracetamol will be given. So what are the drug-drug interactions? That will be isoniazid and acetaminophen, that is concurrent use of this paracetamol and isoniazid may result in increased result of or risk of hepatotoxicity, and this paracetamol and isoniazid. Similarly, isoniazid and rifampin, that is rifampicin, may result in hepatotoxicity, and pyrazinamide rifampin. If you are using this pyrazinamide and rifampicin, may result in severe hepatic injury. So these are all the drug-drug interactions. If you usually anti-tuberculosis, you have to take for a period of at least 6 months. So there is a possibility of this hepatic damage. So they have to, the patients who are taking this tablet for a long period, they have to check their hepatic function, and if there is any hepatic injury, they have to be very careful. So what is the drug food interaction? If you are taking the acetaminophen along with the cabbage, that will result in the decreased acetaminophen effectiveness. So cabbage may enhance the glucuronization of acetaminophen to inactive metabolites. So if you are taking the cabbage as well as acetaminophen, that will lead to inactive form of acetaminophen will be formed. That is, inactive metabolites will be formed. And rifampicin along with the food may result in decreased rifampicin concentrations. And if we are taking isonic acid with the food, that is concurrent use of isonic acid and food may result in decreased isonic acid exposure. What is the patient counseling has to be given to the person with the tuberculosis? Educate the patient about the disease severity and the importance of adherence in therapy and the complications of the tuberculosis. First thing, we have to educate the patient that they have to take the medicine properly. They should not skip any medication, and patient are advised to use tissues to cover when they cough or sneezes. This is very important since it is a droplet infection. We have to ask the patient to cover with a tissue paper while cough and sneezing. So tissue should be disposed appropriately. That is also an important point. They have to dispose the tissues, and a surgical mask must worn by the patient whenever they leave the isolation room. So they have to wear the mask in order to avoid the contamination. It is well and good. And ask the patient to take the medications properly. Normally, tuberculosis medications, at least they have to take at least for a period of 6 to 9 months. So you should advise the patient to take the medications properly. They should not skip any dose. Regarding the drug profile, isonic acid should be administered on empty stomach, and rifampicin should be administered 1 hour before or 2 hours after the meal. And rifampicin uh, stains body fluids such as urine, saliva, sweat, sputum in orange red color, so which is harmless. So you should educate the patient after taking the rifampicin, their urine or saliva, sweat or sputum will appear orange red in color, so which is a harmless one. So you can advise them that there is no problem of this color change. I hope you could understand this case study on tuberculosis. We will meet in the next case study. Thank you, one and all.